Hello and welcome to our webinar on preparing for your COVID-19 vaccination. This webinar will cover what will happen when you get vaccinated and how using a social script will help autistic people prepare for their appointment. My name is David Tong and I'm very proud to be your MC today. I'm the Executive Manager, Autism Connect and Capacity Building at Amaze, and I will host this session today. So Amaze, in partnership with National Disability Services, have developed social scripts to explain the process of getting a COVID-19 vaccination for autistic people. We'll be sending out a link to these that you can download at the end of this webinar. We will also send any presentation links after the webinar as well. And there'll also be a question and answer session at the end. So please send through your questions on the chat and we will moderate those. We have had some questions that have already been sent in, so we will group questions together and we will ask the panel. There is also closed captions at the bottom, if you can see, that you can turn on and off. Please, you will be on mute and the camera will be turned off just to save some of that bandwidth. But please use the chat if you need to communicate with us. But before we start, I'd like to acknowledge the Wurundjeri people of the Kulin Nation and pay my respects to their elders past and present. The Wurundjeri people are the custodians of the land on which I am presenting today, but I would like to extend that respect to Aboriginal and Torres Strait Islander people that are here as well. We have got guests on a panel today, which we're really excited about. We've got three panelists. Sarah Fordyce is the Victorian State Manager for National Disability Services. She'll be talking first. So welcome, Sarah. Willow Metcalf, that works with us at Amaze as a lived experience consultant. And luckily, she also assisted in the development of the social scripts. And we've got Dr. Shiraz Makri, who is a champion, a clinical champion with the Department of Health's Vaccine Champions Program, which is a fantastic program. So we're going to start with Sarah Fordyce. And Amaze, as I said earlier, Amaze worked with the National Disability Services to develop these social scripts so that anybody who might be feeling anxious about the vaccination process can prepare. So I'm going to hand over to Sarah and she'll talk for about 5 minutes. Thank you, Sarah.
Thanks very much, David, and welcome everyone here today. So I work with National Disability Services, which is the peak body for service providers, disability service providers across Australia. And a major focus for us at present is working to assist disability services and the people they support to cope with the current pandemic and now the vaccination rollout. In Victoria, our Safer and Stronger team, which is co-led by Heather McMinn and funded by the Department of Families, Fairness and Housing, have been delighted to work with Amaze to collaborate in the production of the 2 social scripts. COVID-19 is throwing up so many challenges for us as a society, within our organisations, and on a very individual level. The provision of clear information in formats such as social scripts is critical to helping everyone understand what's involved in vaccinations. And we're really hoping that these scripts will help reduce anxiety and concern. Our NDS staff, Heather and Eugene Liston, have really enjoyed the process of staging the photographs in line with recommendations from consultant Willow Metcalf and Amaze staff member Fiona Ransley. Dylan Snowden, our NDS photographer, has applied his creative eye to capture the images that bring these stories of vaccination to life. We'd also like to thank the staff of the Warrandyte Road Medical Clinic in Ringwood, who willingly agreed to be the GP setting, and the Victorian Government's high-volume vaccination clinic run by Melbourne Health staff at the Melbourne Exhibition and Convention Centre. So all these people who took part were very interested and keen to support the development of this resource. NDS is looking forward to supporting Amaze with the promotion of the 2 social scripts. We believe they're going to be a really useful resource in helping people visualise the vaccination process, and they're going to be relevant to many, many people in our sector. So thank you.
Thank you, Sarah, and the partnership's been fantastic to work with you and your team, and I think we've all got a lot from that. So now I'd like to introduce Willow Metcalf. Willow is an Amaze lived experience consultant. She provided advice, as we said, on the COVID-19 vaccination scripts, and has also recently had her first COVID-19 vaccination. So we'll be talking with her about the benefits of social scripts for autistic people, as well as her experience of getting vaccinated. So welcome, Willow. I've got a few questions for you. So the first one, can you explain what social scripts are for those who are maybe new to them?
Yeah, sure. So a social script is a type of strategy that can be used to introduce people to new or challenging environments or experiences. It's presented in the form of a story and uses images and first-person language like I and me, so that it's more personalized for each individual who's going to use it. They're useful for people who might be feeling anxious about something new or something that they might find challenging. But they're also just good to use to prepare somebody for an experience or an environment, even if they aren't feeling anxious, just to prevent anxiety from developing. And so that everyone understands the sort of appropriate ways to be acting and keeping safe in these situations. Personally, I was diagnosed with autism when I was 14, and despite my social anxiety, social scripts weren't a tool that were ever really recommended for me or brought up, so I didn't know much about them until recently. And I think that it was perhaps assumed, because I'm, as you know, generalizing, you know, as girls often are with autism, I can be quite effective at sort of masking it in order to try and fit in, you know, a bit better at school or something like that. And so I think it may have been assumed by the health professionals that I saw that it was just something I didn't need because I didn't appear to need them. since starting to work with Amaze and being able to help to create social scripts, I've come to realize the full benefits of them. And it's made me realize how much they would have really probably helped me in the past and today. Because I've always had a lot of that social anxiety, particularly around doing new things and going new places. And when I was a child in particular, it would often prevent me from doing things. And so not knowing what social scripts were when I was younger, I sort of learned to almost create my own. Like I would, fully research an event or a location before I would go. I'd walk around on Street View to try and find where I might go in and where I would park and stuff like that. And so it has made me wonder how many of those times where I couldn't do something because of my anxiety might have been avoided or made easier if I had had the use of social scripts.
Thanks, Willow, and thanks for sharing your story. How do you think preparation can help someone who's getting a COVID-19 vaccination?
Well, obviously vaccinations can be understandably nerve-wracking. There's this sort of a fear around them often. Particularly, I used to be very scared of them. I've sort of seemed to have grown out of it, which is nice. But so preparing prior to getting a COVID-19 vaccination can reduce a lot of that anxiety, particularly if, preparing beforehand, like using a social script, can help to manage the expectations of what might happen on the day, which, will really reduce anxiety, because often if you don't know what's going to happen and you're perhaps a little bit nervous, you can sort of create an idea in your head of what might happen. I know I do this. You sort of create these expectations of your own of what's going to happen. And often they're a lot more awful and chaotic than what's actually going to happen, which is actually very simple and not that horrible. And so actually preparing beforehand can give you a clear expectation of, the process and how it's actually not as frightening as you'd thought it was in your head. And it can also just make it more likely that you might feel more comfortable in future doing something new if you've had this successful experience preparing beforehand and doing something new. So yeah.
Great, thank you. And so how does someone use the social scripts?
So you can download the social scripts from the Amaze website in the days before your vaccination and review them at home. Read them to yourself or even have someone read them to you. You can also print the scripts if you have a printer, have access to a printer, or even just have them easily accessible on your phone, because that way you can bring the scripts on the day of your vaccination and go over the steps as it's happening. There are also 10 questions that everyone has to answer before you get a COVID-19 vaccination. And these questions are available with the social scripts. So if it's easier, you can prepare and write the responses to the questions ahead of time so that you don't have to think of them on the spot while it's happening.
Thanks, Willow. So we mentioned earlier that you'd recently received your first dose of the COVID-19 vaccine. Did you find the social scripts helpful?
Yeah, so as I said before, social scripts were never a strategy I was that aware of until recently working for Amaze. However, as I was able to work on these social scripts, I got to read the drafts of them and go over them and actually go over the COVID-19 vaccination process in both the clinic setting and the mass vaccination setting. So I found it really helpful to go over the social scripts beforehand. Even though the social scripts are general, because obviously it would be a bit impossible to do one for each individual location that's doing a vaccination. So, it's still a new experience when you're going somewhere new and unfamiliar, but it takes that anxiety out of it, or it did for me, knowing what the process will be. So regardless of this new location, you know that the process is going to be essentially the same. And it allows you to see the elements that might be challenging and prepare for them. So for me, I found it to be very busy, very overwhelming, bright lights, lots of noise, not my favorite kind of scene. But I was prepared for it because I'd read the social scripts and I knew that that was going to happen. So I had things with me that, you know, I enjoy, like my headphones, you know, and it made it way easier.
Great. So final question at this point for you, Willow. How can health professionals support autistic people in feeling comfortable and prepared when they get vaccinated? So
obviously health professionals can recommend social scripts, you know, where relevant for things like a vaccination, because they are a great tool for reducing that anxiety. Health professionals should also be aware that people might come in to see them with a social script, you know, when they're getting a COVID-19 vaccination. And you should be supportive of that. You know, it should be normalized because they're a great tool to use. It would help if health professionals can try to follow the sequence of the social script as best as they can, because that would lessen any anxiety and, you know, ensures the comfort of the person if they know that that process is going to be what they expected. And you should also be aware that and supportive of the fact that a lot of autistic people coming to see you for their vaccination might have items that comfort them with them. Like for me, I had my trusty headphones, and might even have another person with them to give them support. And finally, I just wanted to say that I understand that, you know, health professionals are often, even outside of a pandemic, under a lot of time pressure, which must be very challenging. But it's important to keep in mind that autistic people need just that extra bit of time to process information. And so when you're asking questions and providing information about the vaccines or, you know, what they should expect, you know, it's important to make sure that you've been understood and that you've allowed that sufficient time for the brain to process, so that, you know, that your patient isn't just sort of going, yeah, but not actually taking anything in. Yeah.
Thank you, Willow, and thank you for all the hard work you've done with us in the past and also on these social scripts. I think we expected a lot, trying to get them out as quick as we can, and I think they're amazing. And with that in mind, everyone will receive it on email and the link to download them. So thanks again, Willow, and I'm sure there'll be a couple of questions for you in the panel towards the end. So our next speaker is Dr. Shiraz Makri, and is the clinical champion with the Department of Health's Vaccine Champions Programme. Dr. Makri has an interest in encouraging and safeguarding the community from further detriments of the COVID-19 pandemic, and we thank him for that. He has an interest in helping those that are hesitant or low in health literacy, and he's also the president of the Muslim Health Professionals Australia. So Dr. Makri is going to give us a presentation and a bit of information on the available information in Victoria. So hopefully I hand over to you.
Thanks, David. I'll just share my screen. Okay. Can you see that all right?
Yes, I think that's working, yeah.
Okay, great. Okay. All right. Well, thank you for inviting me today to be part of this launch of the Amaze social script. It's definitely a very exciting time, and it's very relevant for me to learn from Willow about this script, and I look forward to using it in my clinical practice as well. So I'm a GP, and I've been involved with COVID-19 vaccinations. I've been giving vaccinations in the clinic that I work in, and also in some of the other vaccination hubs as well. Okay, so starting off with the key messages for the community is to get tested as soon as you have symptoms. So ideally the first day, if you have any cold, if you like, symptoms, whether it's a cough, a sore throat, a fever, feeling a bit short of breath, or having a runny nose, it's important to get tested. And particularly if you've been at an exposure site, and those exposure sites are constantly updated on the Department of Health website. So if you've been at an exposure site, or if you have any symptoms, be sure to get tested as soon as you can. And whenever you go into any venues and facilities, have your QR code app ready to scan in. So whether it's a petrol station or a shop or any facility you go in. And so if there's an outbreak at any point, it will make it easier for contact tracing, identifying if someone's been an exposure site to get tested. So vaccinations and testing are both free for anyone living in Australia. You don't have to have any sort of insurance, any visa, don't need a Medicare card. It doesn't matter what passport you have. Everyone is eligible to have a vaccination, and anyone can get tested. So COVID safe behaviours that are just behaviours that we have to get used to and adapt and follow, regardless of vaccinations and whether you're fully vaccinated yet or not. So I'm fully vaccinated, but I still have to follow all of these COVID safe behaviours. So keeping a mask handy just whenever you leave your house, or keeping it in the car or in your pocket. It's important to keep a mask. Masks really do work. It'll really reduce your chance of getting COVID or any cold or viral symptom. And it's important to have a good seal just around your nose. So just make sure the mask covers your mouth and your nose completely. Once again, check in using the Service Victoria app QR code whenever you enter a facility, a shopping centre, or any public place. Continue to follow social distancing. So that's about roughly 1.5 metres apart. Wash your hands regularly using hand sanitizer. So I just always keep in mind that whenever I enter a place, before I enter a place, and when I'm leaving a place, I just sanitize my hands. So if you're going into a coffee shop or a restaurant, just clean your hands when you're going in so you keep others safe, and then clean your hands again when you're leaving that facility or place. And that way you're not carrying any germs out with you. And as I said in the previous slide, as soon as you get the first sign or symptom, get tested. And then wait at home until you get a COVID negative result and all your symptoms disappear. And so it doesn't matter what symptom you have. You don't have to have all of them, but even one symptom, just get tested. And of course, get vaccinated. And that's what we're talking about today. So the symptoms, of course, can be a fever, can be a runny nose, a sore throat, a cough. You can get chills, some shortness of breath, or a loss of sense of your smell or your taste. So I'm still speaking to patients that are getting cold and flu-like symptoms, and people are thinking, oh, is it just a cold or is it COVID? But it doesn't matter, because it's really hard to tell apart what could be the coronavirus or what could be just a common cold. So any of these symptoms, just get tested as soon as you get any symptoms, and stay at home, of course, until you have a negative result. So who can access the vaccine? We've got the priority groups in the phase 1A and phase 1B groups. So people working in quarantine or frontline healthcare workers and things like that. But it also includes people with a disability or an underlying health condition, which makes one more vulnerable to get the COVID virus. Currently, all people above the age of 40 are automatically eligible to get the COVID vaccine. All Aboriginal and Torres Strait Islander people aged 16 and above can get vaccinated, and NDIS participants aged 16 and over, and carers of people of NDIS participants of any age can get vaccinated. With regards to the two vaccinations that are being offered currently in Victoria, there's of course the Pfizer and AstraZeneca. So anyone above the age of 60 is being offered the AstraZeneca COVID-19 vaccine, unless there's a very specific reason or a very specific medical condition, which means that you can't get AstraZeneca vaccine. In that case, you'd get the Pfizer. But you can talk to your GP about that. But otherwise, generally, everyone above the age of 60 is eligible for the AstraZeneca. And people below 60 in Victoria are recommended to get the Pfizer vaccine. People under 60 can get the AstraZeneca in some exceptional circumstances, but you would have to talk to your GP, and that would require a consent process. But basically, anyone under the age of 60 is eligible for the Pfizer. people with a significant disability can access reserved first dose appointments. So anyone who's at a high risk of contracting or getting sick from COVID-19 can get vaccinated at these special reserved appointments at the vaccination centres. And in order to do that, you can call the coronavirus hotline to book in a reserved appointment on the number there. There are various ways and means to get the COVID-19 vaccine. So I, of course, work in general practice. So not every GP clinic is offering the COVID-19 vaccine, but you can check with your local GP or you can get online and check with the Hot Docs website to see if a local clinic has the vaccine that you are eligible for. There are, of course, the Aboriginal healthcare centres. There are mobile COVID vaccine teams. So at certain residential care facilities, there'll be mobile COVID vaccine teams that will be coming and offering the vaccine. There are community health vaccine networks such as DPV Health or CoHealth. There are, of course, hospital hubs all across Melbourne, Victoria, which are offering vaccines. There are COVID vaccine clinics, and then, of course, the high volume vaccine centres like the Royal Exhibition Building or the Melbourne Exhibition Building. GP clinics will always have an appointment system, but for some of these other places, they're also taking walk-ins and also appointments. So it really depends on what suits you, whether you'd like to walk in, and you can check the waiting times on the vaccines on the Department of Health website. Or you can get a reserved appointment, or you can book in via an online portal system, and you'll see the website later where you can have an appointment time fixed for yourself if that suits you better. So vaccination clinic locations, there are over 50 open access vaccination clinics and high volume centres now across Melbourne, regional Victoria. There are community health and mobile options. There are participating GPs, GP respiratory clinics, and then the Aboriginal healthcare centres. In reach at support residential services and specific accommodation settings. For bookings, you can go to that website, an online portal system. I tried that myself the other day, so you can just fill in your details, your name and date of birth, and there's a sign-up process. And then you can enter your postcode depending on where you live, and then it'll give you some suggestions of the nearest vaccine centre or clinic that you can go to, and you can book in a time as per your convenience. And of course, there's the number to call as well, if you prefer to do it that way. Another great facility now to support or facilitate access to the vaccination are the DLOs, the Disability Liaison Officers. So there's an online form that you can use to fill the form out if you'd like to access a DLO. Or if you can't use the form, there's, of course, the email to the DLO coordinator on that email address over there. And so that's another great service if you're confused or overwhelmed by the online booking system, or you're unable to get through the telephone line, or if you've got some unique needs for yourself, like wheelchair access or something like that, then I'm sure the DLO coordinator could help facilitate an appointment for you according to your unique needs. Speaking of general practice, I know that if you've got specific needs for yourself, like you're worried about having to wait a long time, or worried about noise and stimulation from other patients, you could let the clinic know ahead of time and wait in the car until you're ready for your appointment and come in. So you can make your needs known wherever you're going. And that's also true for a vaccination centre or a hub. The staff would be happy to facilitate your needs if you have any questions or concerns for yourself. There's also the government benefit through Centrelink, and you can access a taxi voucher to a vaccination centre by calling that 1-800 number. So the COVID-19 vaccine side effects. The side effects can be local, so you can get a side effect on the arm where the actual needle goes in, where there can be a bit of pain around the actual vaccination site. a bit of swelling and redness. You also might feel a bit tired and fatigue. Headache, general body aches and pains, joint pains, chills, fever, all of those things. Getting side effects is not necessarily a bad thing. It's an indication that you've got an immune system that's working and reacting, and that immune system is being taught by the vaccination essentially to know how to fight the COVID-19 virus if you're exposed to it. Most of the side effects occur within the first couple of days, and you can take some Panadol and rest, and they usually go away by themselves. But if you're concerned about any serious side effects after the vaccine, then you can consult or call your GP. It's interesting to note that with AstraZeneca, the side effects are more common with first dose, which is what I had. So I had fevers and chills for the first couple of days, but I knew that my immune system was working. But I was all right with the second dose. But if you're getting the Pfizer, it's common to be better with the first dose, and side effects can occur with the second dose. Everyone who does get the vaccine is monitored and observed for about 15 minutes after you've had the vaccine, just to make sure that you haven't had any serious reaction to it. And any serious reaction would likely occur within the first 15 minutes. So with regards to safety surveillance, the Therapeutic Goods Australia is monitoring the safety of the vaccinations and any serious side effects. We can see here that 51.2% of participants reported no side effects whatsoever, and that's quite normal as well. Some people just don't feel anything after getting a vaccine. 48.8% of participants reported any adverse event, so just one of the side effects you can see on the left side. And only 1% of people reported having to visit a doctor or going into an emergency department. And that's very, very rare and uncommon to get a serious side effect. And you'd normally get that within the first 15 minutes of getting the vaccination. You will receive a handout after you get your vaccination, which lists all the common side effects as well, and some of the more serious symptoms to look out for, particularly with regards to the very rare side effects with the clots that have been reported AstraZeneca, which can occur from day 4 to about 3 weeks after vaccination. Vaccines and faith. So COVID-19 vaccination is supported by a huge range of faiths and religious leaders globally, including the Islamic faith and Catholic groups and so forth. COVID-19 vaccines are halal. And the Australian Fatwa Council has also released a statement to say that the vaccines are permissible and they're halal. So I was in communication with the Fatwa Council about this matter, and so none of the ingredients in the vaccination contain meat products or animal products. Gelatin, things like that. And there are no human or animal tissue cells within the vaccines. There was some controversy with the AstraZeneca vaccine and the use of fetal cells, and I can talk more about that if there are any doubts about that. But there are no animal or human or tissue fetal cells in the actual vaccine that you would receive. Vaccine safety for women. So women that are planning to get pregnant or are pregnant or after pregnancy with breastfeeding, with all of these things, it is completely safe to have the COVID-19 vaccine. And so the Royal Australian New Zealand College of Obstetricians Gynecologists that are specialised in pregnancy have recommended that the Pfizer vaccine can be given in all of these women in all of these stages. For a pregnant woman, it may be the case that having the Pfizer vaccine could also give some protection to the baby. But it certainly does not have any effect on fertility for women who are planning pregnancy. And we know that from animal studies and from the millions and millions of doses of the Pfizer vaccine that's been given overseas. And breastfeeding is completely safe as well. So the takeaway messages about vaccine safety is that we've had more than 3 billion doses of COVID-19 vaccines already given overseas. So that's really reassuring. Millions and millions and billions of people have had it, and most people have been safe and well. The vaccine safety is constantly being monitored. So the Therapeutic Goods Australia releases a transparent, public information on their website of any serious adverse events and things like that on the website. Safety issues are very rare. Most people will just get the common side effects, if anything. If you have any further doubt, you can, of course, talk to your GP or a trusted health professional if you have any personal questions about it, or if you have a personal health condition. GPs are continuing to do telephone appointments as well, so if you're not able to go face-to-face, you can even give a ring, or you can, of course, use the DLO facility that we spoke about earlier as well for your unique health needs. The information about the pandemic conditions may continue to change, and I know that can be confusing. A change in information about who's eligible and what age groups are eligible, and the advice about the AstraZeneca and the Pfizer can be really confusing, but you can talk to your GP. We are keeping on top of all the information as best as possible. Media headlines may be misleading. That's important to keep in mind. It can be really stressful when you read the headlines, and it's important to keep in mind that the newspapers and the radio headlines will always point out the worst information, but they won't mention all the good stuff and the boring information. So I didn't have a serious reaction, so I won't get a headline. So it's good to keep that in perspective as well, and not get too overwhelmed and caught up with all of that. There are lots of online resources, particularly at the bottom of this of these links. I found that the NCIRS website, if you just Google that, that's a national immunisation organisation that has some frequently asked questions that explains quite nicely on there. And just lastly, this final page has the online portal booking system. So if you choose to make a booking online, then that's the link to go to, where you can sign up and book an appointment at a vaccination place that's closest to wherever you live. That's it. Thanks.
Thank you, Dr. Macri. That was great and very informative. There has been quite a few chats and questions coming through. So I'd also like to thank Dr. Sarah Anderson, who's been responding to some of those. We have got other questions that have come in for the panel, so we'll keep working through them. There was one comment, Dr. Macri, around Aboriginal and Torres Strait Islander people 12 to 16 years with specific disabilities, such as respiratory conditions. I think there might have been a recent update, potentially earlier today. I won't say that that's the case, but I think that's what's maybe referring to. And also children under 12 or older than 12 identified as Aboriginal Torres Strait Islander who have a moderately severe illness are now eligible for Pfizer. Do you know anything about that, or is that something we should follow up after the webinar?
What I do know is that the TGA has now approved for the Pfizer vaccinations for kids between 12 and 16, but I know that it's not a blanket rule, and so not all children will be receiving the vaccination, that age group, but children with specific underlying health conditions, and as he said, the Aboriginal and Torres Strait Islander children as well, but that's all I'm aware of at this stage. Yeah.
All right, thank you. So a few questions that come in before the webinar started. So, Dr. Macri, the government's advice about who is eligible for a vaccine keeps changing, particularly the Pfizer vaccine. Can you please repeat what the advice currently is in Victoria, particularly for autistic people and people with a disability?
Yeah, sure. So anyone above the age of 60 is eligible for the AstraZeneca vaccine. anyone above 60, unless there's a very special reason, and those reasons are very, very rare. Unless there's a special reason or a certain health condition that makes it unsafe for you to have the AstraZeneca, and you can speak to your GP about that. But generally speaking, anyone above 60 will be getting the AstraZeneca vaccine. If you're 59 years old and under, you are eligible for the Pfizer. Now the confusion is comes in, I think, when the politicians and the media say that, oh well, anyone over 18 now can get that AstraZeneca. I think that's where the confusion is coming in. So the advice still in Victoria, as per the ATAGI, is that you get the Pfizer vaccine. If for some reason you are wanting the AstraZeneca, because of the waiting time for Pfizer or something like that, you can talk to your GP and weigh up the risks and benefits of that. But otherwise, people with any disability or any autistic person would be generally recommended to get the Pfizer.
Great, thanks for that. And there's a few more for you, but I'll move to Sarah from NDS. And there's the question about how the vaccination social scripts will be distributed. So a bit broader than obviously people getting them on an email today, but broader.
Yes, and I think this kind of highlights the benefit of the collaboration between NDS and Amaze. Both our organisations have pretty well established and wide sort of distribution mechanisms. For example, we have a frequently asked questions linking on our website. We've got a whole sort of COVID-19 area with toolkits and resources and links and information. We'll pop up a link to that. And so that's kind of one way, but we also engage with multiple service providers and are talking about the kind of resources that are available. And we'll certainly be highlighting the social scripts. And we also find using social media is a great way of getting the word out. But I think that what I'd really encourage is if anyone listening today has a look at the scripts and thinks, oh, they look pretty good, like it on your own social media. It's a great way of getting that out, you know. And I suppose I just wanted to kind of, in the same kind of vein, note that whilst these social scripts have been developed, particularly for people with autism, you know, and that is the focus, my sense is that they'll actually be relevant to many, many people, including many people in the disability sector, including people with intellectual disabilities, but actually way beyond that. I think there's many people in our society who are a bit, as Willow said, a bit nervy about what's involved, you know, what's involved at one of these big mass vaccination centres, what's going to happen, and actually seeing some photographs, getting a sense of it before it, so people feel well prepared. I think actually that's going to be relevant to pretty much everyone. Thank you.
Thanks, Erin. And I can see there's a couple of links. I think some of the things you referenced have been posted in by a couple of members of your fantastic team. But based on what you just said, Sarah, there's a question, and I think this can apply to a lot of people. So this is from someone who says, my child is scared of needles. And I'm going to ask Willow and Dr. Macri this as well. How can I prepare my child? What are some good strategies? So maybe Willow, what would you say from your perspective, and then we'll maybe go to Dr. Macri. Willow may have. Are you okay? Are you there, Willow? Yep, great.
Sure. Yeah.
I think we're losing you a little bit. It's dropping.
Let me change internet. You go to Dr. Macri first.
Yeah, great, thanks. So yeah, scared of needles. How can someone prepare their child?
Okay. Sometimes I see parents telling their children that, oh, you know, that the medicine will keep you from getting sick and ending up in hospital or something like that. So that could be a little motivator. but also just having an incentive, whether it's a lolly or an ice cream or something else to look forward to after the vaccination, I think is nice. So it's good to just make that link with the needle with something a bit more positive afterwards, so that they can keep distracted and focus on the reward afterwards. And during the actual needle as well, just reassuring that it's very small, it'll be very quick, and having a distraction, something on the phone or a toy, can often work really well. Yeah.
Great, thank you. Willow, is it working for you now?
Yes, I'm back.
Thank you.
Yeah, I mean, I was really scared of needles in general. You know, as a child and when I was a teenager, and I still don't. I mean, I don't think anybody loves them, but I'm a lot better with them for some reason. For me, you know, it was always helpful nowadays because I've gotten a bit better with that fear. You know, I'm able to go. I went to my vaccination by myself. But when I was younger and I was really afraid of them, it always just helped me to have someone with me. So I usually had my mum with me, and my mum also, she didn't really sort of feed into my fear in any way, you know, so she wouldn't sort of, you know, encourage it, you know, in any way by saying, oh yeah, they can be a bit frightening, you know. She would sort of just be, all right, you know, let's get this done, you know, don't sort of get too into it, because I think then sometimes you start to overthink it, you know. Just try and get it done as quickly as possible. You know, when I had my vaccination done, the woman who did it, the nurse, I was sitting there getting prepared for it, and suddenly it just happened. She just came at me, and then you know, it was so quick. I didn't even have time to panic. But I would also say strategies like, you know, having things that you know are gonna calm you down, even having like headphones on and like listening to something or watching a video, or you know, and also we found when we were at you know, visiting these centers to make the social scripts, we found that they were very happy to make like different accommodations that would be needed for any different person. So like, you know, at the clinic, they were saying, yeah, we can turn the lights off or down, you know, if that's what you want. Yeah, he was giving out lollipops, you know. Yeah, so just find what works, I guess, and try get it done quickly and not allow that time to overthink it.
Right, and any comments from you, Sarah, on that, or generally?
Oh no, I think it's I particularly liked Willow's comment about the people around the person going to be vaccinated, not to sort of feed into and make it a great big thing. And particularly when I think of with children, they so often look at the modelling of what's the parent, so that is the parent making a big fuss about it, or is it and they're also noting some of the strategies that Catherine has suggested, you know, wiggling fingers and toes, and just that thing of distraction as well that was mentioned. I think all of that goes into it.
Yeah, and I think someone else said about numbing ointment, Dr. Macri. I'm not sure if that's making too much of a fuss, was the comment, or not?
I would say probably not necessary to use numbing ointment because it is so quick. I think just using any of the strategies that Willow has suggested or distractions should be fine. Yeah.
Right. And we had a question again for you, Dr. Macri. Someone was concerned that the mass vaccination hubs in the city are going to be overwhelming for me, as they don't like loud or busy spaces. Are there ways they can organise assistance when they get to the hub, as well as using the social script?
Yeah, so one way, of course, is to get a reserved appointment through the number that we spoke about through through the presentation, but also contacting the DLO could be another way to get assistance according to your unique needs. and there are other ways to get around this as well, like having a booked time so that you know when you're going, and perhaps earlier in the morning where things are less busy. But if the mass vaccination side is just overwhelming, then you can perhaps book through a GP clinic at a fixed time, and that could also be convenient, just having a fixed time, waiting in the car for your appointment, and then going in without having to be exposed to crowds and noise and all of that. Yeah.
And there was also a follow on from that around that. I've heard there are some places that are specifically for people with disability. Where are they, and how can I access them?
Yeah, once again, I would probably just go through the reserved appointment phone line, or speak to the DLO using the online form, or emailing or calling that number for any specific mobile units for people with disabilities.
That's great. And I think Sarah's put the link to that in the chat, so thank you for that. And the I suppose the final question is to everybody. What would you say to somebody who's asking you about the social script, and how important do you think it would be to use that before the vaccination? So maybe Sarah, do you want to go first?
Oh yes, no, I think the social scripts are a great additional resource. There's quite a lot of resources out and about. There's TV ads and everything just about vaccinations and so forth. But I think the social scripts are a bit different, and they are, they really take you through that very step-by-step process, and I feel sort of a reassuring kind of way. And I just, as I said before, I think they're going to be sort of terrifically helpful to many people. And I'd absolutely urge people to give them a go, have a look at them and share them widely. Thank you.
Willow?
Yeah, I guess I would say, yeah, I think they're going to be helpful for anyone. And I think that people should not be afraid to give it a go, just using a social script, even if they've never really used one before. Like, I said myself, or I never really used them in the past. And even if you think, like Sarah was saying before, you're not even, sure if, oh, well, does that really apply to me? You might not even be autistic, if you think that preparation might help you, just give it a go, because it'll help anybody, I think, just to see that process laid out beforehand and to have that knowledge. Yeah, I think people should just have a look at them.
Right. And Dr. Macri, also in your answer, there was a question just come in around, can I receive the Pfizer vaccine at home if I'm unable to leave the house? Maybe you could wrap that up.
I think it would be worthwhile just contacting the DLO, the disability liaison officer, contacting them if that could be organised. Yeah.
Great. Well, thank you everyone for your time. Thank you, panelists. Thank you, Sarah Fordyce from NDS. Thank you, Dr. Macri and Willow Metcalf. And also thank you, Dr. Sarah Anderson, who's been helping do some of the chats. And also thank you to everyone who's sent in questions before and in the chats. We'll share the links and share that the presentations and the social scripts following on from this. If you do have any more questions, you can contact Amaze, Amaze's Autism Connect helpline. This is a national autism helpline. You can speak to one of our autism advisors for advice and information by phone, email, or web chat. Or you can search our online directory for autism information supports on Autism Connect search. You can find more about this on our website, amaze.org.au. We will follow up an email to everyone who's registered today. And thank you, everyone. And I will put the information, share my screen now if you want to take our phone number for Autism Connect. But please contact us. So thank you, everyone. And thank you again, panelists.